Welcome to the West Virginia Legislature on the West Virginia Channel. Good morning. I'm Beth Voorhees. This morning we bring you a public hearing before the House Committee on Health and Human Resources for Senate Bill 10, creating the Unborn Child Protection from Dismemberment Abortion Act. The bill is sponsored by Senators Seipold, Ferns, Gaunch, Carnes, Leonhardt, Trump, Walters, Boley, Boso, and Blair. The bill passed the Senate 24-9 on Wednesday, February 17th. It is now before the House Committee on Health and Human Resources. The bill reads prohibiting dismemberment abortions, deeming violations by physicians and other licensed medical practitioners to be a breach of the standard of care and outside the scope of practice that is permitted by law, allowing for discipline from the applicable licensure board for that conduct, including but not limited to loss of professional license to practice for violation. We will bring you this hearing as soon as it begins.
Good morning, everybody. We're going to start our public hearing on Senate Bill 10. Brian O'Donnell, if you'll please come to the podium, followed by Reverend Rose Eddington to follow. We'll have 2 minutes to speak, and then the red light will come on if you could wrap up your comments after that. Thank you.
I'm Brian O'Donnell. I'm the Executive Secretary of the Catholic Conference of West Virginia. It's no secret that the Catholic Church really abhors abortions. The Pope just reiterated that strongly on his plane trip back from Mexico. But we have to face the fact in this country, it's a multicultural society, and others don't have that stance. That doesn't end the discussion, though, about what sorts of abortions would be permitted. And I just referenced the national outrage at partial birth abortions not too long ago. In this case, we're talking about the dismemberment of a child in the womb in the second trimester, a child with legs, arms, face, tearing apart a living child in the room and evacuating it as an abortion procedure. And one would hope that even in this day of gore on movies and computer games and so forth, people's moral sense is not so dulled that they wouldn't be taken aback by such a procedure. In fact, to argue passionately for the dismemberment of a living child in the womb has something ghoulish about it. Over in the Senate, there were presentations. A doctor spoke, OBGYN, about how important it was to keep this in the arsenal of doctors as a procedure, but you'll be hearing testimony that actually contradicts that from other noted OBGYNs. The bill before the House is the result of a number of discussions. It's been amended. I think it's actually a very good bill. My thought is that it really expresses what's in the heart and minds of the vast majority of West Virginians. So the Catholic Conference of West Virginia urges the adoption of this legislation.
Reverend Rose Eddington, followed by Lynn Clark.
I'm Reverend Rose Eddington. My older brother is also a minister. Back in the days before Roe v. Wade, my brother was a Baptist campus chaplain and was part of the clergy physician underground that collaborated to save women's lives from safe, unsanitary abortions. The Roe v. Wade decision was made while I was in seminary, and I was relieved to know that there would no longer be the need for a clergy physician underground, and that making arrangements for secret but safe abortions would not need to be part of my pastoral care. We do not need to return to those days. If you really care about and respect women, our health, and our ability to make our own challenging moral decisions, we would not need to be here today. Legislation restricting choice uses religion to exert power over women. My religion does not teach that abortion is murder. If yours does, please do not have an abortion, but don't legislate your religious teaching onto the rest of us. The idea that abortion equals murder is not a universal belief. It originates in the Catholic doctrine of ensoulment, that a soul is formed when a single egg cell and a single sperm cell join together. Some religions teach that ensoulment happens at the time known as quickening. Others teach that the soul enters the body when the first breath is taken. When a soul joins a body, thereby creating a person, is a religious concern, not a political one. Specific to today's proposed legislation, it is inappropriate to apply the shocking term dismemberment to the safe, sometimes medically necessary procedure known as dilation and evacuation. If there should be any legislation dealing with dismemberment, it should be to dismember the sexual appendage of the men who rape and abuse women. This is the kind of dismemberment that would actually be healthy and safe for women's lives. Is anyone here ready to sign on to that?
Lynn Clark, followed by George Wallace.
My name is Lynn Clark. I'm a woman and a lawyer, and I live here in Charleston in the beautiful state of West Virginia. Roe versus Wade. It's been the law of these United States since 1973. Love it or hate it, it's the law. And here's what it says. For the stage, prior to approximately the end of the first trimester, the abortion decision and its effectuation must be left to the medical judgment of the pregnant woman's attending physician. It goes on to say that more restriction is allowed in the second stage and still more post-viability. This bill, Senate Bill 10, does not even mention stages. This bill does not leave the decision and its effectuation to the medical judgment of the pregnant woman's attending physician at any stage. This bill is a mess. It is badly written, dangerous to women's health, and clearly unconstitutional. And that's why I'm here today, to say this to the honorable members of our West Virginia House of Delegates. For those of you who want to endanger women's lives by restricting access to safe, legal abortions, at least do it in a way that doesn't spit in the face of our established legal system and our Constitution. Thank you.
George Wallace, followed by Nina Minima.
I'm George Wallace. I'm president of Cabell County Right to Life. And at the age of 20, I was involved in an abortion, and it lives with me each and every day. I've been involved in the pro-life movement for 16 years, and I'll be trying to read 3 letters from 3 different doctors for the dismemberment bill, Senate Bill 10. First letter is from Dr. Calhoun. The procedure, I'm going to be reading just partial bits of the letter to save time. The procedure of using large crushing instruments to kill, tear apart, and remove a baby from its womb is repellent. Nothing is so gruesome or painful may be contemplated in the normal course of daily living. Yet it appears that certain healthcare providers want to justify this practice as necessary to this provision of services. Never in my 30 years of medical care as a OB/GYN and over 25 years of maternal fetal medicine has it been necessary to dismember a living baby. My clinical experience spans a time of over 30 years when we had no means to deliver less than 20-week fetus losses except by surgical procedures. Performing these surgeries was ghastly, dangerous, and a horrible procedure. Virtually everyone abandoned these dangerous surgical procedures because of the risks to the mother with regards to laceration, damage to the internal female organs by fetal bone shards, instruments, and significant risk of perforation of the uterus. I personally know numerous maternal fetal medicine physicians, and none of them utilize surgical procedures as their first and preferred method of dealing with 20-week losses or left-in abortion procedures due to the risk of surgical abortion. In fact, I dare say that most would consider it outside the standard of care to offer surgical termination of pregnancy as a first option of care. Second letter is from Dr. Guzman.
Mr. Wallace, just wrap up your comments, please.
Okay.
Thank you.
Well, I just want to say this. We have laws in West Virginia protecting dogs and cats, which I love animals. But I tell you what, we have humans here that are being butchered. And you want to see what this second trimester is, you can go to YouTube, and for 27 minutes and 4 seconds, you can take a good look at what it is, and it'll be well worth your time. Thank you.
Nina Minima, followed by Kate Foreman.
Hello, my name is Nina Minima, and I'm the project coordinator at the West Virginia Coalition Against Domestic Violence, and also a former sexual assault rape crisis center advocate. I'm speaking on behalf of the 14 licensed domestic violence programs that serve all 55 counties in this great state of West Virginia. And we have some concerns over Senate Bill 10. Violence against women is a costly and pervasive problem, and women of reproductive age, in particular, those 16 to 24, are at greatest risk. Violence limits women's ability to manage their reproductive health and exposes them to sexually transmitted diseases. Abuse during pregnancy can have lasting harmful effects for a woman, the developing fetus, and newborns. In fact, homicide is the second leading cause of traumatic death for pregnant and recently pregnant women in the U.S., accounting for 31% of maternal injury deaths. Some women have trouble getting prompt access to emergency contraception, a safe, effective backup birth control method that can prevent pregnancy when taken within days of unprotected intercourse. A study of 474 adolescent mothers on public assistance found that 51%, and 2 in 3 of those who experienced domestic violence at the hands of their boyfriends experienced some form of birth control sabotage by their dating partner. The West Virginia Coalition Against Domestic Violence believes in the empowerment of women and their right to make informed choices. The coalition supports policy that allows women to make decisions regarding all aspects of their life, free from government intervention. Senate Bill 10 impinges on the health and safety of victims and survivors of domestic violence by imposing oppressive and discriminatory practices on an already vulnerable population. So please take the first step and stop the oppressive legislation of Senate Bill 10.
Kate Foreman, followed by Margaret Chapman Pompanio.
Hi, thanks for having us. My name is Kate Foreman. I'm a pharmacist and a mom. As a pharmacist, from time to time, I'm called upon to interact with women that have made this impossible choice to end a pregnancy. It even happened on Saturday. One of my really good patients had been raped. This bill, including my patients, are going to put women in danger. Luckily, we have this practice for second trimester abortions. It's very safe. They can do it with their trusted health care provider. This bill would force women to either undergo something not safe, or two, leave the state and get some sort of procedure from a person they don't even trust or know, some medical provider they may have never met. This bill is very bad for women. It's very bad for the state. And, sorry, it's very hard. As a pharmacist, you really, especially in a state like West Virginia, you really know your patients. They trust you. They come to you with things like this. And I would really, without a doubt, this bill is going to put my patients and West Virginia women in danger. It's bad for women. It's bad for the state and should not be passed. Thank you.
Margaret Chapman Pompanio, I'm sorry, I'm sure I'm not saying your last name right, followed by Bryn Pompanio.
Thank you. You were really close. It's Pomponio. That was really good. Thank you for having us here today. Many of you know me as Executive Director of West Virginia Free, a reproductive health and justice organization that represents more than 8,000 people statewide. But you may not know why I do this work or any more about me. I'm a proud new mama who gave birth to twins over the summer. They're here today with my college roommate who's visiting from California. I'm originally from Ravenswood, about 45 minutes from this great capital. But I want you to know that what is said about those of us opposed to this bill, about this intrusion into women's health care, is unfair. We are loving people. We are children-loving people. In fact, most of us are parents who want to raise our children in healthy, safe communities. We want what's best for women. And you know who knows what's best for women? Women, not the legislature. The legislature doesn't know what's best for a woman who has a pregnancy that is doomed. Senate Bill 10 has no safeguards for pregnancies with fetal anomalies. Why should the legislature demand that what could be a dangerous drug for a woman who is carrying a fetus with no brain be used against the will of her doctor? There are no safeguards for rape or incest victims in this bill. The legislature shouldn't be in a position of dictating to a raped 13-year-old that she bear the child of her father who has forced her to have sex. Imagine this bill would force her to give birth to her sister or brother. Live with that cruel truth. This body should know that's what it's doing. It's forcing doctors to perform procedures that are against their will and against their standard of care. Doctors have repeatedly voiced throughout this bill's history that they are concerned about going against the standard of care. This bill forces a woman or girl with a crisis pregnancy to forgo that treatment altogether, and it's based on the premise that doctors, who bring life into this world, I might add, don't know or care about what's best for their patients. So when your granddaughter, sister, or wife gets pregnant and faces complications, know that you have taken away the ability of physicians to provide the best possible care for her. Where there should be care and compassion, you are putting danger and fear in its place. This makes me sad. Therefore, West Virginia Free joins with the American Congress of OB-GYNs and the State Medical Association in urging you to bring up your compassion and reject this dangerous bill. Thank you very much.
Bryn Pomponio, followed by Caleb Weisenart.
Hello, I'm Bren Pomponio, and I'm a father for two girls and a lawyer in Charleston. As legislators and public officials, you each swear an oath upon taking office to uphold the U.S. and West Virginia constitutions. Included in that oath is a promise that you will not knowingly pass legislation that violates the U.S. and state constitutions. SB 10 plainly violates the U.S. Constitution. And the U.S. Supreme Court has already said so. In 2000, the United States Supreme Court struck down a Nebraska law because it sought to ban the procedure that's specifically outlined in Senate Bill 10. In the case Carhart versus Stenger, the court held that banning the procedure outlined in Senate Bill 10, quote, the most common used method for performing pre-viability second trimester abortions, end quote, was unconstitutional. This same statute's been struck down in Kansas and Oklahoma. I urge you to please uphold your oath of office and reject this decidedly unconstitutional bill.
Caleb Weisenart, followed by Andwin Williams.
Thank you. I'm here today to read a letter on behalf of Dr. Michael Vernon from the Department of Obstetrics and Gynecology at West Virginia University, and Doctors Cassie Leonard and Petronella Mazzaros from the School of Medicine at West Virginia University. The undersigned are physicians in West Virginia or physicians who refer patients to obtain care in West Virginia who write to express our strong objections to Senate Bill 10. We are experts in obstetrics and gynecology and are specialists in women's health care. We are alarmed at the unprecedented attempt of West Virginia legislators to dictate how physicians should perform a safe, common, and evidence-based surgical procedure. Senate Bill 10 represents unwarranted intrusion in the doctor-patient relationship. The bill would restrict the safest and most expeditious way to terminate a second trimester pregnancy. In many cases, these terminations are necessary for the patient to protect her health or future fertility, and the bill lacks an adequate health exception that would allow physicians to exercise their medical judgment in these circumstances. The legislation could also force physicians to provide substandard care to second trimester abortion patients. The undersigned urge consideration of the effects of this legislation on the doctor-patient relationship. If enacted, we urge you to enact laws that reflect the standard of care based on current medical evidence and preserve the doctor-patient relationship, not laws that jeopardize the sanctity of that relationship and threaten women's health. It is our strong belief that the laws in West Virginia should not be changed in this way. We serve our patients, who are often struggling with difficult decisions, the best way when we respect their autonomy, dignity, and their right to the safest care possible. Doctors must be able to make these kinds of decisions according to the best medical evidence and their best medical and professional judgment without political interference. We therefore urge you to reject this harmful measure. Thank you for your time and consideration.
Mr. Weisenart, do you want to submit those letters for our committee to look at, or you just wanted to read them? Okay, all right. Andwin Williams, followed by Frank Hartman.
Hi, my name is Andwin Williams, and I'm here to read a letter to you from Maggie McCabe from the West Virginia State Medical Association. Thank you for the opportunity to speak about SB 10. This is a bill that interferes with the health care between a woman and her physician. A woman has the right of free choice to decide the appropriate health care for her and her body. The decision may be shared with her physician. The general public and West Virginia Legislature have no right to these private health care decisions or discussions. Elective abortions have been a part of a woman's right to choose since 1973. Numerous lives have been saved in the last 40-plus years thanks to the FDA and AMA approved procedures. The West Virginia State Medical Association does not support this bill. As they state, any bill that includes criminal charges to a physician practicing safe medical procedures is irresponsible and wrong for West Virginia. I encourage you to vote against Senate Bill 10. This is wrong for West Virginia, women, and healthcare. My body, my choice. Sincerely, Maggie McCabe, a West Virginia woman who had an abortion pre-Roe v. Wade and knows what women had to go through. Thank you.
Frank Hartman, followed by Sam Hickman.
Good morning. My name is Frank Hartman, and I'm here on behalf of Planned Parenthood Action Fund. And I'm here this morning to urge you to put a stop to Senate Bill 10, which constitutes a dangerous intrusion in the doctor-patient relationship and threatens to expose our state to hundreds of thousands, if not millions of dollars in costly litigation. This bill would ban the safest medical and best practice for abortions taking place in the second trimester. In many cases, these procedures are necessary due to the severe fetal anomalies or to protect a woman's health or future fertility. It is critical that doctors be able to provide the best care possible to their patients without interference. Yet Senate Bill 10 does not allow physicians to exercise their medical judgment or to consider their patients' unique circumstances. Instead, it would force doctors to provide substandard care in many situations. That is why doctors and leading medical groups like the American Congress of Obstetricians and Gynecologists oppose this type of legislation. This is bad for women's health and bad public policy. In addition, Senate Bill 10 represents unconstitutional interference in the doctor-patient relationship. A similar law in Kansas was declared unconstitutional and struck down by the courts, but not before hundreds of thousands of taxpayer dollars were wasted. Planned Parenthood in West Virginia does not provide abortion services, but is committed to ensuring that women have access to the safest, most appropriate medical care available. We urge the West Virginia House of Delegates to stop this dangerous and unconstitutional ban. Thank you.
Sam Hickman, followed by Sharon Lewis.
Thank you, Madam Chair, members of the committee, and others present. My name is Sam Hickman. I'm the Executive Director of the West Virginia chapter of the National Association of Social Workers. One of the highest values of the social work profession is the primacy of the client's self-interest. We are here to oppose Senate Bill 10. It takes away a woman's ability to make medical decisions in consultation with her health care provider. Testimony provided in the Senate identified that there were 6 medically necessary procedures of this sort performed in West Virginia last year. Senate Bill 10 is unconstitutional. Similar bills have been struck down by the courts. Medical experts identify it as legislative interference at its worst, ill-advised, and unscientifically motivated. The contortions that this bill has gone through to this point are astronomical. Senate Bill 10 is a cynical attempt to further curtail the right of women to have sovereignty over their own bodies in an attempt to curry favor with a political interest group. Thank you.
Sharon Lewis, followed by Margarita Hutchins.
I'm Sharon Lewis, Executive Director of the Women's Health Center of West Virginia. We are providers of abortion care and reproductive health services. I'm here in opposition to Senate Bill 10, a bill designed to deny women in West Virginia access to the safest, most common procedure for abortion care in the second trimester. A woman has a right to end an unwanted pregnancy. This extreme bill was crafted by a small segment of the population to impose their personal moral views and their religious beliefs on an entire class of citizens. They want to further restrict access to what remains a legal procedure. It is a fact that restricting access to safe abortion care leads desperate women to risk death to end an unwanted pregnancy. I believe that it would be a beautiful thing if all of the so-called right-to-life advocates would expend the energy that they're currently placing on restricting abortion on improving the lives of the abused child, the hungry child, the neglected child, or the orphan child. We have many of those in our communities in West Virginia. It is in light of that that I ask that you reject this dangerous legislation.
Marquita Hutchins, followed by Eli Baumwell.
Thank you. My name is Marquita Hutchins. I am rector of St. John's Episcopal Church here in Charleston. In the marriage service, the prayer related to children says, "Bestow on them, if it is your will, the gift and heritage of children, and the grace to bring them up to know you, to love you, and to serve you." In that prayer, I read quality of life for children. And if quality of life is not part of the equation, we need to let that stand. Margaret Mead, in 1973, abortion was not her preferred method of birth control. But she says, "I think abortion is necessary backup to our failure to protect women and our failure to provide contraception to anyone who needs or wants it. To argue for a woman's right to an abortion is absurd. Women have a right to institutions which will see to it that they never have an unwanted child for any reason. Women should have the right not to have children if they don't want children or if they cannot provide for the children. If we continue to advocate extreme positions instead of integrated programs that establish quality of life for women and children, we will waste our time being polarized instead of getting anything done. I urge the House of Delegates to uphold the quality of life for women and for children and to vote against this bill, SB 10. Thank you.
Eli Baumwell, followed by Susie Bragg.
Good morning. My name is Eli Baumwell. I am the Policy Director with the American Civil Liberties Union of West Virginia. The ACLU of West Virginia opposes Senate Bill 10. Privacy is a fundamental right. Incorporated in this is the right to make personal medical decisions. Legislation like Senate Bill 10, which seeks to interfere with this right, needs to be considered very critically. On the one hand, there's the effect of the legislation. Proponents of this bill will point out that it doesn't actually restrict the abortion or the medical procedure in question, which begs the question, what does it do? It makes a medical procedure, the safest procedure for rare and usually very tragic circumstances, more painful and more dangerous. On the other side of the equation are rights. This bill interferes with fundamental privacy rights. It interferes with the doctor-patient relationship. It interferes with the physician's ability to provide the best medical care. That's the equation. How is it played out? The other states that have tried to ban this procedure have been embroiled in costly litigation to defend the bans. They've been enjoined from even enforcing them. That itself a sign that the bans are likely to be held unenforceable, or in some states found to be unconstitutional and unenforceable. Why would we risk the same here in our state? Again, for these reasons, we oppose Senate Bill 10. Thank you.
Susie Bragg, followed by Alexandra Gallo.
Good morning. I don't stand here before you as a lawyer or a doctor, but I stand before you as a victim of what the lies that women are told about abortion. 16 years old, I found myself pregnant. I was raped, statutory rape by a man that worked for my parents. I also was a foster child in their home. It was my social workers that I trusted, that they oversaw me, that took me to have my first abortion at 16. I remember them taking me to Pittsburgh to a clinic. I was too far along. I come home. Of course, my parents were upset, so I had to go for a second term. I was 18 weeks pregnant when my abortion was performed. I was told, as they sit down and counsel you, that it looked like that of liver. It was not formed, it was just tissue. I was also told that it would be pretty much like your menstrual period until they started. And I started screaming for them to stop because of the pain, and they held me down as they finished that. You're supposed to trust the doctors, what they tell you. I am going to be 58 in 2 weeks, and to this day, when a doctor tells me it's not going to be that painful, I do not trust him. How did I find out the truth about the doctor's lies to me? This is the actual Newsweek article that I found in a hospital waiting room in March. My baby died January the 7th. When I looked down, I remember to this day my reaction. It says, at 16-week-old fetus. This is dated March the 3rd, 1975. That's how I found out the truth. I trusted the doctors. I trusted the social worker. What I have before you here is my medical records I wrote for. They failed to tell me that my aborted baby, which was a girl, would have a death certificate. She's counted in the vital statistic records as dying. These babies in second trimester are these babies. They feel pain. When my baby died, my abortion, I could feel her moving around inside me. And when I asked the doctors, because I've had 2 abortions, second trimester, one's a saline, could feel the baby moving, and I asked the doctors what it was, and they said it was just your muscles. And I didn't realize I'd went into labor till I had my son. All my kids were born early.
Ms. Bragg, can you wrap up your comments?
So please, please, if you have a true heart, yeah, I hear it's about the women, but it's about the babies that are suffering and being ripped apart. Could you imagine what it would feel like to have your arms, your limbs ripped apart, and understand women are being lied to?
Alexandra Gallo, followed by Sheila Barajas.
Good morning. Senate Bill 10 does not protect women or increase access to health care. No one knows a woman's body better than herself. Managing reproductive health and having the power to make decisions empowers women. Historically, women have been suppressed and have been put in a position where we aren't able to make decisions for ourselves, and we have come a long way since that This legislation is extremely regressive, and it's unconstitutional. Senate Bill 10 what it does do is it strips women of their right to make a personal decision with their trusted healthcare provider. This legislation continues to suppress women just like me. Women deserve choices and deserve access to the safest, most common procedure to end an unwanted pregnancy. Senate Bill 10 fails to protect me, and it fails to protect women just like me. Major mainstream medical experts like the American Congress of OGs oppose these measures, noting these restrictions represent legislative interference at its worst. Doctors will be forced by ill-advised, unscientifically motivated policy to provide lesser care to patients. That is not right. The ultimate goal of this legislation is to take away women's health services one by one. West Virginia has the lowest rate of abortion. And to further reduce unintended pregnancy and the resulting need for abortion care, the West Virginia Legislature should promote the health of West Virginia women by increasing access to health care and not taking it away. Thank you so much.
Chayla Barajas, followed by Mary Ann Buchanan.
Good morning. My name is Chela Barajas, and I'm speaking on behalf of Paige Mueller-Liley, who could not be here today. She says, "Dear legislators, I'm concerned about the way that you, our state legislators, have been working on a large number of social issue bills and not working at all on the economic problems our state faces. SB 10 is a prime example of such a social issue bill. SB 10 is a bill in search of a problem to solve. Depending on the year, there are maybe 1,900 legal abortions being performed in West Virginia annually, based on my view of some numbers from Kaiser Family Foundation and Guttmacher. In the U.S., the vast majority of abortions are performed during the first trimester. Those that happen later are likely to happen later precisely because legislators have been interfering in women's health decisions for a long time. And because these actions have emboldened domestic terrorists in scaring providers out of providing the service. If you calculate raw numbers based off of CDC percentages, then perhaps a grand total of 27 of these abortions in West Virginia are happening past 21 weeks. And I would guess that many of them involve fetal anomalies discovered during the mid-pregnancy ultrasound, often done right about 20 to 21 weeks. It is these cases where families are making excruciating family decisions. And meanwhile, you are making their grief that much greater to bear, both in restrictions to access, active shaming, and by emboldening abortion opponents in their sidewalk counseling. I cannot for the life of me understand what is pro-life about making it more difficult for a family to decide to terminate a wanted pregnancy when they have reason to believe that the fetus, if it survives the length of pregnancy, will not live on its own. If there are no fetal anomalies, the research is very clear that a large proportion of these abortion cases are among women who would have wanted to get them sooner but could not afford them. These delays result in higher costs. There are areas of this state where women cannot access reasonable maternity care, even for wanted abortions. Access to abortion providers is even more difficult for these women to obtain, and delays are all but inevitable.
Mary Ann Buchanan, followed by Karen Cross.
Good morning. My name is Mary Ann Buchanan. I'm the Program Director for West Virginians for Life. What I'm about to do is read you portions of a testimony of Anthony Levatino, MD, JD, a former abortionist. From 1981 through 1985, I performed approximately 1,200 abortions. Over 100 of them were second trimester suction D&E procedures up to 24 weeks gestation. The first task is remove the laminaria that had earlier been placed in the cervix to dilate it sufficiently to allow the procedure you are about to perform. The first instrument you reach for is a 14 French suction catheter. It is clear plastic and about 9 inches long. Picture yourself introducing this catheter through the cervix and instructing the circulating nurse to turn on the suction machine, which is connected through clear plastic tubing to the catheter. What you will see is a pale yellow fluid that looks a lot like urine coming through the catheter into a glass bottle on the suction machine. This is the amniotic fluid that surrounded the baby to protect her. With suction complete, look for your Sofer clamp. This instrument is for grasping and crushing tissue. When it gets a hold of something, it does not let go. A second trimester D&E abortion is a blind procedure. At 21 weeks gestation, the uterus is thin and soft, so be careful not to perforate or puncture the walls. Once you have grasped something inside, squeeze on the clamp to set the jaws and pull hard, really hard. You feel something let go, and out pops a fully formed leg about 5 inches long. Reach in again and grasp whatever you can. Set the jaw and pull really hard once again, and out pops an arm about the same length. Reach in again and again with that clamp and tear out the spine, intestines, heart, and lungs. The toughest part of a D&E abortion is extracting the baby's head. The head of a baby that age is about the size of a large plum and is now free-floating inside the uterine cavity. You can be pretty sure you have a hold of it with the Sofer clamp when it's spread apart about as far as your fingers will allow. You will know you have it right when you crush down on the clamp and see white gelatinous material coming through the cervix. That was the baby's brains. You can then extract the skull pieces. Many times a little face will come out and stare back at you. I often hear the argument that we must keep abortion legal in order to save women's lives in cases of life-threatening conditions that can and do arise in pregnancy. During my time at Albany Medical Center, I managed hundreds of cases by terminating pregnancies to save mothers' lives.
Miss Buchanan, wrap up, okay.
In all of those hundreds of cases, the number of unborn children that I had to deliberately kill was 0.
Karen Cross.
Good morning. I have a memo to submit to the committee from Mary Spalding Balch, JD, Director of State Legislation for National Right to Life. But I'm going to give you some of her talking points and some of my own. In 1998, the West Virginia Legislature banned a particular type of abortion, the partial birth abortion. And this law, Senate Bill 10, is nearly identical to the partial birth abortion ban because it bans one specific procedure. Because of the close resemblance of the constitutional issues settled in the Partial Birth Abortion Ban Act case to those applying to the Unborn Child Protection from Dismemberment Abortion Act, it is highly likely that the U.S. Supreme Court would uphold it against constitutional attack. That's based on Gonzalez v. Carhart. This law has not been struck down in any state. It is pending trial, and the outcome is not yet determined. The court in Gonzalez reiterated that where it, quote, where it has a rational basis to act and it does not impose an undue burden, the state may use its regulatory power to bar certain procedures and substitute others, all in furtherance of its legitimate interests in regulating the medical profession in order to promote respect for life, including life of the unborn. End quote. The court in Gonzalez upheld the federal law protecting unborn children from partial birth abortions based on the government's, quote, interest in protecting the integrity and ethics of the medical profession from the gruesome nature of this procedure. This law does not create an undue burden. Neither did the partial birth abortion ban, because other methods can be used. This law provides protection only when dismemberment is applied to a living unborn child. There are at least 12 studies. I have abstracts of those 12 studies to submit to the committee today. There are at least 12 studies which have been done by the abortion industry that show maternal safety is not compromised as a result of providing a fetucidal agent prior to abortion. Dismemberment of a live, fully formed baby in the second trimester may be the standard of care for abortionists. However, for regular medical practice, many OB-GYNs report that there is no medical emergency that requires dismembering a living baby.
Ms. Cross, thank you. Thank you very much. This concludes our public hearing. Thank you for coming.
You've been tuned to a public hearing about Senate Bill 10, creating the Unborn Child Protection from Dismemberment Abortion Act. This bill passed the Senate 24-9 on Wednesday, February 17th. It is now before the House Committee on Health and Human Resources. This concludes our broadcast this morning. We will be back at 11 o'clock with action from the floors of the State Senate and the House of Delegates. Until then, I'm Beth Voorhees for the West Virginia Channel, a service of West Virginia Public Broadcasting.